And so consequently there are drivers at play that politicians of any colour are going to have to deal with. And indeed, the Labour Party had already started along this path before we came in, with the current coalition government. The only thing I would say, though, just in terms of party politics, and that's to do with the money, the last government undeniably increased spending on healthcare. I mean, without a shadow of a doubt, they doubled it. They doubled healthcare spending in about an 8-year period. In that time, what happened to services at Hillwood? What's happened to healthcare services generally in this area? It's pretty questionable to say that they've improved. It's in some little ways around the edges they've improved, but actually there's not been a significant improvement. The point I'm trying to make is, it isn't just about money. Some people locally have tried to hijack this whole thing for party political purposes, all right? And I have resisted, and will continue to resist, any engagement on that level. But all I'm trying to suggest is, if it was about money, why didn't Heatherwood improve in that period? Heatherwood 1997 to Heatherwood 2010.
Again, there's been, I've
It's
lived
not
in
just
Bracknell
about money.
for 27 years, and there's always been the rumour that there's a hotel chain going after that site for years.
Well,
So,
it's hugely valuable, isn't it?
yeah, so, you know, and then the services have slowly come down to a point where the hospital isn't viable.
Now,
So
some
you
of
don't even want to
yeah.
go there now, you know.
I mean, some of that is to do with how healthcare money is in the appendix of my project, of the proposal. You'll see a huge table of pounds per head population. That will annoy you intensely. I put it in there for a reason, to annoy the people of East Berkshire intensely about how come they get spent less money on them per head than Greater Manchester and everything else. Just in 1 year, if we had an equal with some of the parts of the country, we could pay for this. 1 year. Now that's something which is a topic for another day, but I think this region's been shortchanged for many, many years under both colours of government. And it needs to stop. It really does need to stop, and we need to take an opportunity, whilst we've got this property that's worth so much, to say, right, okay, we're going to consolidate our assets into one site. It's going to benefit all of us. Instead of what we've got at the moment, which is the incremental cuts, where the money goes from Wickham to Aylesbury, and the money goes from Heatherwood to Slough, which has been going on. Actually, if we all pooled our resources, we could get something that we could all be proud of, and more importantly, feel secure that there's an appropriate place for ourselves and our loved ones to go to at times of need. I think it's worthy of support. Of course I do. I've invested quite a lot of my time in it. All I can say in conclusion is that I will continue to press in Westminster on the need for the consolidation of acute services nationally, and I will keep citing this as the local example that I'm pushing. And hopefully, in time, we will get to where we need to be. I just hope it's not too long a time, and I hope there's some courageous people and some people with vision and leadership within the National Health Service who can actually say, right, yeah, we're going to do that, we're going to consolidate there, and I will, if it's a reasonable location, back it 100% to the hill politically, because that's why I'm in politics, to be honest with you, Mr. Dugan. Anyway, well, look, thank you for coming this evening. Thank you. Appreciate your attendance. Could you spread the word as best you can? And if there's a need to have a further meeting to sort of feedback, I will do. If something significant happens, I'll have another meeting. If there's a need for us to consolidate around a particular campaign for a particular site, I will of course convene another public meeting. At the moment, there's nothing to report, but I will persevere.
Is the actual site allowed to be known? Because at the moment, we've got a cross right in the middle of the junction.
Yeah, I mean, well, the site is if you know the area, when you get to junction 89, it's, you know, the A308, is it? It goes into Maidenhead?
Yeah.
Yeah? If you go down that road, it's the bit on the right. It's the triangular piece of land between there, the M4 and the Hollyport Road. It's a big triangular piece of land. It's about 75 acres. It has been in the past earmarked for a series of different things, including maybe a football club relocating there, as well as a private hospital clinic, some residential stuff, etc., etc. It is in the ownership of one family who didn't contact me. As I said, I didn't have it in mind, but it turned out actually that it was the right size piece of land, and it was clearly had been earmarked for some sort of development at some point in the future. So those of you who know how planning works, that usually means it's quite a suitable type of piece of land. And as I said, it was a welcome bonus in the context of my plan that there was something feasible. But you know, there are plots of land everywhere. So you know, it's not the only piece, but it's the piece that I've sort of concentrated on because I needed to choose somewhere, and we've constructed some sort of drawings around it. But interestingly, you know, there are other suggestions have been made to me, but it's I think it actually lends itself to a hospital. I actually, you know, point out that there is an argument for a road from Junction 89 to Bracknell anyway. If you come off at Junction 89, there's no left-hand turn as you come out of London. And I don't know whether there's a historic reason for that, but it's an unusual junction, Junction 89, because you can't turn left as you come out of London. That's another campaign for another day. But you know, if we were getting a new hospital there, that certainly would be something I would want to
Well, we've already got, you know, the
Marlow
bypass which runs into there, so there's no reason why there shouldn't be a bypass.
It would be a topic for another day, but which would clearly shorten times and things else. But let's just see whether we can get the hospital progressing in a certain direction before we start talking about any other detail. Anyway, thank you very much.
Thank you.